Well, hello everybody. Good morning. My name is Ricardo Cabrera, and I'm the operations manager for the Latino Chamber of Commerce of Boulder County. And today we have a group of beautiful ladies here that's going to talk to us about the Ombudsman Program from the AAA Division of Boulder County. So, Erica, can you tell me a little bit about the AAA Division of Boulder County?
Sure. So we're, like you mentioned, with the Area Agency on Aging, and that sort of encompasses all services related to older adults in Boulder County. So that age that people refer to as over 60. So that's the directive of the Older Americans Act. And so within the AAA, we have programs that are information and referral, health and wellness programs, financial assistance, Medicare counseling, LGBTQ older adult programming, and caregiver initiatives. And we also have the veteran services housed within the AAA for Boulder County as well.
Okay, excellent. Erica, tell me, okay, so you guys are part of the Ombudsman program, and tell me a little bit about yourself. What's your role in here?
So me, I'm the lead ombudsman for Boulder County, so I supervise this program. And the Ombudsman Program is really a part of the Older Americans Act. It's something that's required federally for us to be monitoring the implementation of regulations in both assisted livings and nursing homes. And our region is Boulder County, but they're everywhere. So ombudsmen cover every nursing home and assisted living in the country.
Oh, wow. So tell me a little bit about the history of ombudsman. Where does it come from, or how did this start?
It's a really hard to pronounce governmental word, ombudsman, and it really originated when governments moved from monarchy to democracy, so that there was sort of an intermediary between the government and the people, the citizens. And so for us, this sort of evolved to our role as the intermediary between residents, the people who are living in long-term care, and the facility that is providing the care for them. And so we sort of help to make sure that the regulations are being followed, but also that the residents' voices are being heard, and they have all the rights that they had prior to moving into long-term care. So they get to participate as much as possible in their day-to-day lives, regardless of where they're living. That's the gist of it.
Yeah, excellent. Wow, it is a hard work to say, and I hope I get better by the end of this interview. All right, so what is exactly an ombudsman then? So now we know the history. Tell me, Shanna, what is exactly an ombudsman?
Yeah, so we are a third-party advocate. We are not affiliated with the facility, and we're really there to support the resident. So we advocate for resident rights, which are part of the federal and the state regulations. And we're really focused on helping residents to have the best quality of care, the best quality of life. So we're coming from a different perspective than staff, probably also from families, where we're advocating for the express interest of the resident, which often goes against that medical model, which is really what the best interest is. So it's whatever the resident wants. And our program is resident directed. So that means the resident decides how they want us to help them. So sometimes they reach out to us and they just want to give us a complaint. They don't want us to help at all. Other times they reach out to us and they want us to be very involved. They want us to talk with staff. They want us to have a care conference with them. So it really depends on what the resident wants. We are a confidential program. We're also not mandated reporters. Our goal is really to establish this trust with the resident. We have no agenda other than to be there to support them. Besides the complaints that we take, we also talk about long-term care options with families, with residents. We talk with them about what to look for in a long-term care. So a home that would really best fit what their needs are, or the needs of the loved one. So we're also talking about all the homes in Boulder County.
Wow, that sounds like a really fulfilling job in the end. I'm sure there's stress and pressure because you're dealing with families and doctors and older people. And well, I can just think of about 25 questions or scenarios that, from what you said. But tell me this, you keep saying residents. Who are your residents? What is your age group? Do you have a qualification, or who do you serve exactly?
Sure. So it would be anybody who's living in assisted living facilities or skilled nursing facilities. So some homes are 60 and over, but there are other homes that have younger populations, individuals with disabilities, individuals living with mental health. So it would be anyone who lives in the facility we would serve.
Oh, okay, yeah, no, so that opens it up to anybody that really can't fend for themselves for whatever reason, and that they are dependent on other people to make decisions for them almost. Wow. Okay, very cool. So COVID times, these are different times. You guys are still working, same as before, some adjustments?
Ashley?
Oh, yes. So we are still completely available to residents, facilities, families. The only difference is that we're not physically going into the nursing homes and assisted livings right now. So we're doing all of our work remotely. So that's via phone, via video calls. So we're completely available that way. A re-entry plan is being worked on. We don't know exactly when that will take effect because everything hinges on the public health data, and that's constantly changing. But that plan is currently in the works. And we're continuing to discuss different ways that we can reach out to more residents and staff and remind them about our program.
Okay, so Ashley, tell me about, you guys offer all these services in Spanish as well?
Yes. So while none of the three of us are Spanish speaking, we have been able to successfully serve Spanish speaking folks by utilizing some of the other amazing Spanish speaking staff here at our agency. Mm-hmm. You might have seen those on some of the other interviews. And we also have a translation phone line that we can use to mm-hmm. have translation happen in real time for conversations.
Okay, cool. And is this mandated? Is this part of the regulations that govern you guys, or is this a service you provide in addition? And what would this, I mean, who governs you anyway?
Well, we have a few different bosses.
Oh.
We are Boulder County employees, and certainly as employees of the Area Agency on Aging, we're bound by some of the federal regulations that govern that. So the State Unit on Aging provides a lot of policies and procedures that speak to our role. But we also are certified by the State Ombudsman, and that's a sort of a different entity. So because I mentioned the Ombudsman is all over the country, there's a National Ombudsman Association, and each state has sort of a state representative that serves the whole state and supervises and certifies us. And that's who provides direction, like Ashley mentioned. What are going to be the policies that guide what our reentry is going to look like when we go back in, and that's who decides whether if there's a complaint that rises above us, that's where it goes, not necessarily to the Area Agency on Aging, but really to the State Ombudsman. That's who oversees the whole program for us. Okay,
sounds like there's a lot of regulation going on over here.
Oh, yeah.
And that could be good, and but it also gives us a lot of paperwork, homework. I'm sure that happens.
Lots of documentation.
Yeah, cool. So, Ashley, tell me a success story. An example of something that you're proud of.
So, since the pandemic has started, since it's really changed the way things work. But I think this is still a good representation of what we do all the time. So I was contacted by the family member of a resident who was in a nursing home here in Boulder County. Trying to set up their isolation wing to come into compliance with the new pandemic specific regulations. The family member was upset because the resident was really easily confused at this point, and they worried that moving them into a different room at this point of their life would continue to for them. come together and all the needs could be met. And I suggested just that the resident be moved to a different room away from the isolation wing, but into a room with the exact same layout, and have everything in the room laid out the same way it was for them now, to sort of decrease that confusion. So it almost sounds like a little silly, and we certainly have more complicated cases than that all the time. But I think it's a good demonstration because we really try to work collaboratively with everyone to accomplish what the resident wants. And sometimes that just means thinking creatively about the solution, coming in with fresh eyes, and coming at things with a new approach.
Very nice. It sounds like a great place to be. So you work with independently, and you help mediate anything that may come up between the facility, the resident, and the family if they're involved. And you guys are neutral, siding with the resident. Is that right?
Exactly. So we are independent. We're not affiliated with any of these long-term care facilities. So we're able to come in independently. But like you said, we're always going to be on the side of the resident.
Yeah. Yes. Excellent. Excellent. Wow. Well, this sounds awesome. Wonderful. So what other services do you guys offer?
Well, I think that, like Ashley mentioned, there's a lot of collaboration, not just with long-term care, but there's also a lot of community partners that we're working with. So certainly within our agency, we provide a lot of resources. We get a lot of calls about what would be the most appropriate setting for my family member. So because we go to every single long-term care facility in the county, we're really able to give a broad picture of what the options are to people. And then if people need services outside of long-term care, we really partner with the senior centers, the resource specialists who work there. We can guide people a little bit to review sort of what the surveys have been. So both with the state health department, that's the governing body for long-term care, but also people a lot of times want to know how many stars does a place have? And so we'll kind of help people navigate through Medicare.gov. We help people connect with Medicare counselors if that's what they need. And then if things are more serious, if there's a more serious situation that's happening that involves abuse, we work a lot with adult protection, sometimes with the police department if we need to, just to kind of make sure that the resident is being heard and thought about during that whole process, since it's really traumatic, but also that any kind of investigation that needs to happen is happening. So there's a lot of community partners that we work with and we depend on to facilitate any of the other kind of services that might help residents in long-term care.
Excellent, beautiful. So let me just finish up today with asking you a surprise question. Yep, a surprise question. Ashley, tell me what's your role first. I didn't ask you earlier. What's your role with the with AAA with the Ombudsman?
So Shanna and I are both staff ombudsmen.
Okay.
So we work, like Erica was saying, within the AAA under the guidance of the state ombudsman. And then we also do have several volunteer ombudsmen who really do the same work that we do, just on a smaller scale. So Shanna and I each visit about 20 buildings. Our volunteers normally visit 1 or 2.
Okay. And you guys are located in Boulder or Longmont?
Our offices are in Boulder, but we work with facilities across the county. So Boulder, Longmont, Lafayette.
Okay. Yeah. So just so everybody knows, I'm going to put you guys' information here in the description of this video. When it's recorded, I'll put in phone numbers. So I'll get all this stuff from the internet, but a little description about what you do, a phone number, an email address, and all that stuff. Ashley, what is your favorite word?
My favorite word?
Yeah.
Well, I have to go with advocate, I think.
Okay, good. Well, you're on the right job then. Okay, Erica, so what is your favorite sound?
Favorite sound? I suppose that changes from day to day, but maybe right now I'd like to hear a little bit of rain falling on the roof and the streets outside, maybe. Yes,
excellent. There you go. Thank you, Erica. And Shanna, your surprise question is, what motivates you?
I think what motivates me is these success stories that we have from residents, and going to talk with them and learning about their life, that really is what motivates me in this work. I really am missing this face-to-face contact with them because, you know, they just bring me a lot of joy.
Good. Well, thank you, ladies. It's been a pleasure talking with you guys. And well, until we meet again, thank you for being here.
Thank you so much for having us.
Thank you.
Thank you.